So next up is our first pitching session. This is the first 4 of our startups who will each have a 3-minute pitch. Well, they'll tell you about what their startup is, what they do, and what they're asking for. So I'll hand you over to the first startup, which is Restful.
Let's talk about sleep. 2/3 of UK adults do not regularly get a good night of sleep. And chronic sleep disruption is implicated in and potentially causal in diseases like Alzheimer's and cancer. My name is Greg Getter, and today I want to introduce Restful. We're solving this problem of epidemic proportions. It started with a simple idea. Blue light before sleep can interrupt your sleep. You see, before the advent of electric lighting, people spent their nights in relative darkness. And now that we're surrounded by TVs, computers, phones, and electric lighting, we're getting a blue light signal all the time. And that is messing with our circadian rhythms or sleep cycles. So Bedtime Bulb is a light bulb that you use in the evening in place of your existing lighting, and it reduces blue light. And we've had quite a bit of success with this product. We've sold more than 20,000 units to more than 12,000 customers, and we're expanding internationally. But we're not stopping there. It's our mission to give 10 million people a great night of sleep by the end of next year, and here's how we're going to do that. The first is with Atmos. We're taking the concept of Bedtime Bulb and making it a lot smarter. Atmos is the first smart lamp that will dynamically adjust to your individual sleep needs. So it'll give you the right light at the right time of day to promote optimal sleep and wakefulness. And we're also working on the Restful app, which is even more accessible. Most people have a sense that things like caffeine, light, and food can affect their sleep, but they don't know exactly how much to consume and when exactly to cut it off. The Restful app is going to be the first app that helps you understand how these things affect you individually. So we could use a little bit of a help. The first is that we're looking to seek clinical validation so we can eventually expand the circadian lighting concept into a healthcare environment. The second is that we are looking to expand into physical retail more within the UK and Europe. So if you know anything about those 2 subject areas, I would love to speak to you. And finally, if you are interested in improving your sleep or you know someone who really needs help with sleep, you can purchase Bedtime Bulb on our website, bedtimebulb.com, or on Amazon UK. Thanks so much and sweet dreams.
Right, Jane, it's over to you.
Okay. Hi, my name is Jane and I work for Salus Fatigue Foundation, a charity based in the West Midlands, helping people with fatigue. In 2015, I was a fit, healthy and active PE teacher and mum. Then in 2016, life came to an almighty stop. System overload led to system shutdown. I had widespread pain, I had lead for muscles, I had to have help getting dressed. I struggled to write and speak coherently. And you know, in Men in Black, when they get the pen and they zap your memory, it was like that. Huge chunks of my memory have gone from that period in time. I'm not alone though in this life-impacting fatigue. There are 260,000 people in the UK for whom a good night's sleep just doesn't do it. Where does this fatigue come from? Well, a huge range of conditions, longer than listed here. And obviously, unfortunately, recently, we're hearing about the awful fatigue from long COVID. Often, after diagnosis, health professionals are left unsure with how to help us manage our fatigue. Salus has the answer. We have self-management via our Fatigue Wellbeing Hub. We have education via our workshops, and we have support through our online groups. We know we're needed. £542 million was the UK Health Service spend just on chronic chronic fatigue syndrome alone in 2017. We are funded by hub subscriptions, by donations to our charity, and by local funding. 75% of our beneficiaries reported that they were using less or no medication as a result of following our programme. If that's the case, then we have the potential to help the NHS save £28.5 million. So now it's over to you. Please keep your workforce healthy. Share us on your wellbeing hub or include us in your wellbeing policies. Ensure all stakeholders in your absence management programme are aware of us and refer to us. And please consider donating to us. £100 will pay for 3 education sessions that we could roll out to hundreds of people. Help us to help more people, please. People like Judith and Angela, Kath, Jane, Peter, Janet, Sophia. Please help them to return to their families, to their work, to their communities. I really look forward to having a conversation with you. Thank you for your time. And can I also thank my son, George, who helped in the production of this PowerPoint presentation. Thank you.
Anthony, over to you.
Hello there, my name is Anthony Blackburn and I'm the founder of a social enterprise called Golf in Society. Our social mission is all about transforming lives. And in this presentation, I'll give you an insight into how we do it and, more importantly, why it's about so much more than golf. The inspiration for my social mission was my dad. He loved his sport and all he needed towards the end of his life was a little help to keep enjoying it. The issues we address are the growing crisis in adult care, the blight of loneliness amongst adults, and an aging population living with increasingly complex health issues. In addition, we tackle a crisis in unpaid care. It's estimated that 8.4 million are living with a long-term health condition of their own. Here's a real-life example. Alan has Alzheimer's and Fiona has cancer. And this photo was taken 4 years ago at one of our golf days. Sadly, Alan is now in full-time nursing care and Fiona is still fighting cancer, and both are just 60 years old. It was an absolute privilege to support them. So what's our unique solution? Well, in partnership with our customers, we've co-designed a range of golf days that support older adults to enjoy a happier, healthier life. Our golf days have 4 major benefits for some of the most inactive, disadvantaged, and vulnerable adults in society. Firstly, it's good for the body, as each session delivers 2/3 of the recommended weekly exercise. Secondly, it's great for the brain, as you make 27 major decisions when you play a golf shot. It's good for the soul too, as we give people a chance to socialise and keep connected. And finally, the unpaid carers. They get the chance to enjoy 2 hours of respite, which, in their own words, is proving to be a lifesaver. So what's our special recipe? Well, it's straight from Mother Nature's cookbook. We use her key ingredients of purpose, place, and people, and sprinkle everything we do with compassion, dignity, and respect. So far, we've successfully delivered over 650 golf sessions and transformed over 300 lives. And this message from Ben to thank us for transforming his dad's life will stay with me forever. So we'd like to make Sheffield the first age-friendly golf region in the world. By opening 15 venues, we will create hundreds of jobs, transform thousands of lives, and start to level up health inequalities once and for all. To make this happen, we're looking for a £250,000 investment over 2 years in return for £4 million worth of social impact. I look forward to working with you to make this proposal a reality for the people of Sheffield, and thank you for your time.
Right, great, thanks. And it's over to you now, Jen.
Hi everyone. everyone, my name is Jen Turner. I'm a physio, I'm the founder of JT Rehab, and I'm the inventor of the S-Press. It is an easy to use portable leg strengthening device. It's been devised to speed up recovery, prevent muscle deconditioning and improve patient outcomes. So 68% of older people admitted to hospital do not recover their previous level of mobility. So that often means that they need a care package putting in or equipment, which is very expensive and also takes a long time to organise. We've got just under half of delayed discharges from hospital caused by slow physical recovery. Now that has massive implications for patient flow through the hospital and also a massive cost of £390 million a year to the NHS. So we've got overstretched physio teams who have very few options for effective leg strengthening for patients, particularly older patients. So they're extremely frustrated about not being able to easily deliver high quality gold standard care. Now I know this because I was one of them, and that's why I invented the S-Press. So it has a patented leg support system. So that allows the patients to easily use it unsupervised. So that basically frees up the physio teams. It uses effective, proven progressive resistance to strengthen all the muscles in the leg for the sit to stand action. So just like you would find a gym piece of equipment in the gym, but it is fully compliant with tissue viability and infection control, and it is conveniently able to be used in the patient's bed or next to them while they're sitting in the chair. So we're basically enabling physio teams to see more patients more effectively, more often. So 96% of physios polled in an independent proof of market stated that the S-Press could help their patient group. We've got critical care, particularly, and older people's rehab saying it could be a complete game changer for their services. And we've done PPI and focus groups with patients and relatives, and there is an absolute desperation for more physio intervention on wards. So we've done some clinical testing with prototypes that we've had, and we've shown an increase in ability, speed and confidence with sit to stand. So we believe there is a market for an S-Press in every hospital and every care home in the world. So its price and effectiveness make it substantially better value than any competitive product. We're working with a great team, and we've got 4 sites at Northamptonshire Healthcare ready to do clinical evaluation. We've got an extremely excited clinical director and research team down there ready to start. So we've already gained £150,000 in funding so far to get to clinical approval and pre-production prototypes. So we're now asking for £200,000 and a manufacturing partner to get us to production and to market. So let's get the S-Press to market. Let's see more patients more effectively, more often. Thank you.
So we're now into our second pitching session. And so I'll hand you over to GP Video.
Hi everyone, I'm Eva Laiko from Alsad Medical, a digital health company from Hungary. In the UK, 1 in 8 people are at risk of developing chronic kidney disease. Kidney treatment required about £1.5 billion of the NHS budget last year. Treatment includes complex medication and a restrictive diet. As the condition advances, patients need expensive and time-consuming dialysis treatment or a kidney transplant. Main reasons behind chronic kidney disease are uncontrolled diabetes, obesity, or cardiovascular problems, often caused by unhealthy diet and lifestyle. COVID infection can also cause kidney failure. Diet and lifestyle elements are often overlooked or neglected in chronic care, although could significantly slow down the progress of the disease. ALSA stands for Automated Lifestyle Advice, which is the name of our web application. Artificial intelligence helps the user to get personalized assistance optimized for condition management and care goals based on personal and medical data, needs, habits, and preferences. Alsad also connects the patients with human clinicians and dietitians for monitoring and support. Our application can be inserted into care plans by health providers. End users may also sign up directly and get connected with doctors and dietitians via a secure virtual channel. Alsad core technical team teamed up with medical partners Fresenius Medical Care Hungary, Semmelweis Medical University, and expert dietitians for co-design, validated content, and patient experience. By now, over 500 patients use our application. Most of them are patients of a private hospital in Budapest. Besides benefit for the individual patient or dietitian, Alsad can make a difference on the public health level by slowing down the progress of the disease using a combination of digital monitoring tools and direct services for healthier diet and lifestyle. We are really glad that AWRC Accelerator with Sheffield Hallam University helps us to adapt the product to the UK market, providing expert advice, mentoring, regulatory support, and introduction to the UK digital health and innovation ecosystem. And we would love to hear from you if you are interested in a collaboration as a partner, a nutrition specialist, a potential investor, academic partner, or a representative of the NHS or a private health organization. So let's help millions of patients with a chronic condition together. Thank you.
Hi, I'm Dr. Tom Adler, an NHS GP and CEO of Peak Medtek Limited. We have developed Bide, a unique bedside device to reduce the risk of nighttime falls in the frail and elderly. Falls cost the NHS £4.6 million per day. That equates to £49 million per year in Derbyshire, with the average cost of a fall being £7,500. As a GP, I have also seen the catastrophic effects of falls on my patients and their families. With 25% of the UK population aged over 65, healthy ageing and independent living are priorities for the NHS and the government. 1 in 2 of over 80s falls every year, and up to 20% of those falls occur at night, most often when getting out of bed to go to the toilet. Now that can be due to low blood pressure, medication effects, poor mobility, dementia, or just maybe not taking the time to set themselves properly and stand up safely. So with Bide, it's not about detecting falls, it's about preventing them before they happen in the first place. So with our light and motion sensors, by switching on the bedside light or sitting up in bed, Bide voices a soothing or encouraging pre-recorded message from a loved one, a carer, or a health professional. That might be take your time, count down from 10, remember your frame, or something as simple as, Mum, we love you. Anything that just prompts them to set themselves properly and stand up more safely. There's no direct competition in our space, with a combination of in-the-moment reminder, no Wi-Fi or Bluetooth needed, no third party involved, and our dementia-friendly capacity. This is Brian. He's a patient of mine. He used to fall every night when getting out of bed. He's been using our Bide prototype for the last 3 years and has had no nighttime falls. It's a miracle, it really is, he says. So we have pilots of 10 devices in individuals' homes in Stoke and 20 devices in care homes in Wolverhampton, with excellent interim feedback and support from dementia specialists and dementia friends. We're launching Bide in July 21 with direct sales to individuals purchasing Bide for their elderly loved ones, but also B2B2C, NHS and social care, for example, falls response teams and post-hospital discharge, but also care home providers, third sector and smart housing. With the unit cost being so high in the NHS, Bide at a one-off purchase retail price of £100, including VAT, can create enormous savings for the NHS and social care. For example, in Derbyshire, that would equate with annual savings of up to £330,000. I'm working with Rob Evis, my co-founder, who's also business developer and design engineer. Please contact us if you're interested in hearing more about Bide. We're also looking for a £250,000 investment to develop a digitally enabled Bide 2 with a subscription business model. Thank you.
Hello everyone, my name is Shahar Figelman and I'm the CEO and co-founder of Selfit Medical. We're a digital therapy startup based in Israel, so hello from Tel Aviv. Next slide. So we all know the numbers. There are roughly around 1 billion people in the world over 60 years old, and it's going to be 2 billion by 2050. And with aging, there is a growing need for prevention and rehabilitation therapies, but this market still depends on one-on-one session between a therapist and a patient. And there are so many potential patients, but just not enough therapy. So there's a huge gap. And this is why we see more automation, AI, and self-care services. So we have developed a unique human-machine interaction, a therapist robot, focusing on brain and heart conditions, which are the most common disorders among the elderly population. The robot on the right side is our B2B solution for hospitals, clinics, and nursing homes. And on the left, you can see our home care version, which is basically a smaller and more affordable solution for self-care. We see a number of use cases for this kind of interaction, from neuro and cardiac rehab to wellness and prevention programs. So what our robot can do? Like a human therapist, our robot starts with saying hello, continuing with clinical assessments to better understand the patient's status, and then proceed to exercise and treatment. The interaction with the patient is conducted through the floor. The floor is our playground. The exercises are designed for the most common problems to improve balance, movement, reaction time, memory, and many more physiological aspects. We are using augmented reality technology to project therapy sessions on the floor, demonstrating the patient what exercise you need to perform, how to perform them better, and at the same time, monitoring the patient's ongoing performance. We use this data with our AI engine for personalization of the process and to optimize neuroplasticity and motor learning techniques for better outcomes. Currently, our product is installed in several leading hospitals and care homes in Israel. We've ran a couple of pilots and a clinical study with stroke patients. The study has shown great results. We saw better patient outcomes, better level of efficacy and patients' engagement, and we'll keep working on further research to validate on a bunch of other areas. So our team, we all come from tech and health, working on various aspects of computer vision along the years. We also have a few advisors specialized in aging, neuro rehab, and AI. We're looking to partner on research and always looking for business partners and more funding. Thank you for your time.
So we're now on to the final four pitches. We've saved the best till last, obviously. So without further ado, it's over to Buddyboost.
Great, thank you. Hello, my name's Robert Tansey. I'm the founder of Buddyboost, and we're on a mission to help 1 million people feel healthier and happier. And if that sounds like a big target, don't worry, because we've done this before. I was the leader of Sky's involvement in cycling and inspired over 1.6 million people to get on their bikes. So what is Buddyboost? Well, it's a public health intervention and a workplace wellbeing tool based on a unique body system, which is particularly effective at helping inactive people to start moving more, something which delivers immense benefits both to the individual and to society. And we're already up and running. We've raised £230,000. We have nearly 6,000 users who between them have now logged nearly 100,000 activities on the app. We have over 10 paying clients. And just this week, we've signed a license agreement, which will significantly increase both our reach and our revenue. So how does it work? Well, it's an activity challenge delivered via our simple and engaging app, where people buddy up in groups of up to 6 and support each other to do 26 minutes of exercise a day for 26 days in order to improve both their physical and their mental well-being. And it's very inclusive because it can be any activity. And it really doesn't matter how far or how fast people go, just that they do their 26 minutes and support their buddies to do theirs. And buddies really are the secret ingredient. And we see this through amazing engagement in the private buddy group feeds in the app, for our corporate clients in their own branded feeds, and at a community level when we're engaged by local borough councils. And the data shows that it absolutely works. On average, people's mood goes up by 24% on completion of their daily minutes. buddies on average do nearly 40% more days of a challenge than people who try to go it alone. And 95% of that inactive cohort say that having a buddy really helped them complete the challenge. So buddy power really does work. You can see here that we're already ahead of target for the year and that the growth plan is achievable. But we also believe there's now real upside. In a working from anywhere world, companies are increasingly looking for initiatives that help colleagues do something fun and meaningful together that isn't yet another virtual meeting. In our next funding round, we're looking for £350,000 to further enhance certain aspects of the tech and to really ramp up our sales and marketing. So if you'd like to buddy up with us, please get in touch. Thank you.
Hi. Hi, everyone. I'm Candice Hampson, CEO of Liminal Health based in Buckinghamshire. 5 years ago, I was diagnosed with early stage breast cancer. After years of treatment, thankfully, I have been cancer-free for the past 3 years, but it was not an easy journey. I couldn't find credible information or support to help me change the habits I needed to. I was never told that getting enough physical activity, for example, could reduce my risk of recurrence by 30 to 40%. Cancer is one of many long-term illnesses affecting the UK today. 1 in 3 workers face at least one chronic condition, while 1 in 5 face 2 or more. Resulting churn can be expensive at 30k per lever, and attempts to address this have not been working. Many long-term conditions are preventable through lifestyle changes. Not many people are supported in improving their diet, exercise, and stress levels. It may seem simple, but these are difficult changes to make on your own. Liminal Health works with employers to provide personalized content and health coaching, activating lifestyle and behavior change in employees affected by chronic conditions, such as cancer, IBS, diabetes, and long COVID. We currently deliver one-on-one human coaching. Over time, we will reduce the need for humans, filling that gap with personalized content relevant to specific users. We will create self-navigable content modules and will provide disease-specific information to people, supporting their journeys to recovery and wellness. The potential market is huge. Millions of people of working age are affected by these conditions, and 45% of businesses already offer workplace wellness programs. We have lots of room to grow. There are many new startups offering workplace mental health services. We are better, because we offer a holistic take on health that addresses not only mental health, but also nutrition, physical activity, mind-body connection. We also offer breadth in conditions that we support, as well as a more personalized service than traditional wellness benefits like yoga classes and fruit baskets. We have shown great traction to date. We have 3 paying clients, delivered over 50 coaching sessions, and are proud to be working with 2 health sector support programs. We also have a fantastic team. I bring deep patient experience and business development from over 10 years of innovation consulting and impact investing. Christine, my co-founder and CMO, has over 20 years experience in content marketing for global brands. And our head of product and tech, Yurian, comes with over 10 years in developing health tech products. Our advisors also span the clinical psychology, health, and tech sectors. We are currently raising a 250k angel round to close at the end of March. We've already secured a majority of this round from a pre-seed fund, as well as some angels, leaving less than 50k in EIS eligible investments in this round. Please do get in touch if you'd like to hear more. Thank you very much.
Hi, my name is Kai Yang. I'm the founder of Etexsense. We develop a textile medical device for joint pain relief. There are 5 million people in the UK who suffer joint pain. Joint pain stops people engage with activities, impact on their sleeping quality. It can also lead to disease associated with inactive lifestyle. Knee joint pain is mainly caused by the wear and tear of the joints, such as osteoarthritis. It is also caused by injury. Our product is a wearable electrotherapy device. we integrate our novel dry electrodes in a piece of garment. The electrodes are connected to an electronic control unit, which can send electric impulse through the skin to interfere the pain signal transfer and boost body painkiller release. It is comfortable to wear, easy to use, washable, and reusable. It enables people to manage their pain at home without need of drugs or clinicians. We have secured over 100,000 grant funding, which is active free. This enables us to develop our medical product through the collaboration with physio center and end users. We will launch our first product May this year. And we have also developed a quality management system certified by NQA, which is a global certification body. It is for development, manufacture, and distribution of electrotherapy device. This enables us to develop a range of products as the company grows. We also build partnerships with suppliers, distributions, and end users. We are a team of 3. I have 11 years experience on electronic textile for healthcare. I have secured a $2 million research grant as a principal investigator in my previous work and founded 2 companies. Tyler has a PhD in electronics, has 5 years experience to develop a wearable electronic. Liam has 50 years experience on medical device regulation. We are looking for customers who can benefit using our products, distributors, and a business partner who is interested to use our technology to develop other applications. And we also looking for people with business experience who can join our team, help us to secure investment and grow the business. Thank you.
Hi, I'm Tommy Parker, CEO at KiActiv, and we're a digital health company making people's personal everyday physical activity an accessible and effective medicine for improving health and well-being, long-term condition management, and rehabilitation. Our digital therapy is clinically proven to empower sustainable behavior change for physical activity and improve people's self-care without the need to visit clinics or gyms. It has no barriers to age or mobility and is proven to engage hard-to-reach groups and be effective in areas of deprivation. Physical activity is crucial for the prevention and management of long-term health conditions, is the cornerstone of many rehabilitation pathways, and improves our mental and physical well-being, enables us to age well, living our best lives for longer. However, existing interventions are restricted to exercise and have failed to engage those most at risk or inspire sustainable behavior change. Harnessing the benefits of physical activity is about understanding that every move we make matters, and our approach expands the therapy window from just a few hours of exercise per week to include all 112 waking hours, helping people to discover the opportunities to move more within the context of their health, capacity, and environment. We analyze physical activity data from a validated device across multiple dimensions, which are all independently important to health. Data is instantly displayed in the user's personalized online dashboard, which is available 24/7 and incorporates clinically proven behavior change techniques to provide meaningful and actionable feedback. Telephone support is given by a trained KiActiv mentor at key times during the first 12 weeks, and this helps the user gain the confidence to plan, monitor, and improve without the need for compulsion or prescription. This new personal understanding gives people the tools to make self-endorsed behavior change, driven by their intrinsic motivations, which is proven to be more sustainable than external factors such as nudges or rewards. We've demonstrated sustained behavior change for physical activity across multiple health conditions, and it's also acted as a powerful catalyst for other lifestyle change, providing further benefits to health outcomes and quality of life. By looking at the multiple dimensions of physical activity, which each have an independent impact on health, we can establish a comprehensive picture of physical activity and the net impact of our behaviors 24/7. This enables us to accurately measure health impact and provide evidence of clear economic benefit for all of our stakeholders. We've been successfully delivering our service to NHS patients and others over the past 3 years, including throughout the COVID pandemic, where we've delivered remarkable results. We want to reach more people and work with NHS organisations, employers and community providers to deliver measurable health benefit and social impact. So please get in touch to help us make this happen. Thank you.